So I'm Dr. Ariella. I'm CEO and founder of OvumAI, the first AI health partner for women. And so our mission is to transform every woman's experience of healthcare and to close the gender health gap. So Ovum is coming in the intersection between two really interesting industries, artificial intelligence and women's health. For so long, the technologies in this category have been focused purely on reproductive health. As we know, 47% of conditions that are contributing to the gender health gap are not reproductive health focused. They're conditions like migraine, headache, mental health, autoimmune conditions. And so we believe that Ovum is completely transforming what femtech means. So I was in my third year of medical school and I began suffering with chronic vestibular migraines. So I was really struggling to even look at lecture screens, stand in clinical appointments. And even as a very health literate young woman, I struggled to get the care that I needed. I didn't get medicated for 3 years. I was told my pain was just anxiety. And I realised then, both as a doctor and as a patient, that the healthcare system was completely broken when it came to women's health. And I realised it was due to three main things. So firstly, women were fearful of the healthcare system due to decades of being dismissed, marginalised and often misdiagnosed. They were going to social media or family and friends rather than healthcare providers. And this was leading to lower health literacy and a rise in chronic health conditions. Second of all, my background in reproductive biology prior to medicine allowed me to see that our healthcare system was siloed when it came to women's health, despite our physiology being cyclical and interconnected. And thirdly, I began to learn about the research gap, which is the fact that women have not been equally represented in clinical trials for decades. This impacting our treatments and our diagnostics, but even how I was being trained as a doctor. These three issues are contributing to what we're now calling the gender health gap, which is the fact that women are spending 25% more time in poor health compared to men. And then it was really that light bulb moment. I was driving on my way to medical placement and I thought, if we have a book that tracks children's development over time, why don't we have something like that for women? And that's when Ovum was born. What Ovum is doing is using artificial intelligence in a way that's women specific, whether that's the design, the tone, even the clinical guidelines that we're using to train it. And we're co-designing with women. It's allowing women to integrate all of their health data across their lifespan so they can be empowered through health literacy, advocate for themselves in clinical appointments, which we know leads to better engagement in preventative health behaviours and overall health outcomes. We're running this like a fashion company, something that's beautiful and aesthetic and engaging for women, not something clinical and masculine. We want this to be about value, about community. From that comes loyalty, and I think that will be really important for Ovum, and I think that's why we're already a leader in the field. So we know that artificial intelligence and femtech are both rapidly expanding markets. So combined, there's a $3 trillion global opportunity, and I believe Ovum is going to capture that. The research findings that come from that, I hope, can translate into more devices, more diagnostic algorithms, translatable innovation that can actually improve women's healthcare. We hope we can be the smartest artificial intelligence for women in the world. The gender health gap is a global issue. It's a global economic crisis, and we're the only company doing what we're doing. And so I'm really excited to see this intersection between AI and women's health, both for Ovum, but for other technologies in the next few decades.